I'm Dr. Deuk Laser at the Deuk Spine Institute, here with a patient who has traveled from Indiana, but you came here because you were having pain in your lower back and your upper lower back. So you had 2 disc herniations that you came here for laser surgery. We performed the laser surgery. We found some tears in the back of the disc with herniated nucleus pulposus, and we saw them endoscopically. We cleaned them up with a laser. How do you feel?
Pretty good. I don't have any of the pain. I mean, it's a little sore from actually having surgery, but
a different kind of pain.
Yeah. It's just so much different. I can sit and be fine. Like it used to be, sitting used to be the worst. I can sit for, half an hour maybe. And then it's I got to do something about it, lay down or just to take that pressure off.
Yeah, and you chose to come to Deuk Spine Institute. How did you find us and why did you choose to come here?
I had talked to a few surgeons because I was finally I had tried so many things. Just got to the point where I was like, I have to have some kind of surgery. Nothing else is, even the things that worked just didn't have the endurance. They didn't last.
Where was your pain?
So I had some in my L5-S1, but a lot of it was in my L1, L2, and it would come out into my ribs. My lower back would just naturally tense up and try to bend forward. And I don't have that now. I can just sit and be comfortable and not have to try to, hold things in place. And yeah, so it's
awesome. So what did these other surgeons recommend for you back at home?
They told me they could not do anything for my cervical. For my lower back, they wanted to do a disc replacement for my L5-S1. Just couldn't really understand it because I'm the pain that I'm having is higher, it's more towards my mid.
So they ignored your L1-2 disc problem?
Yes,
they
completely.
Didn't, because it was more subtle on the MRI. It was more of a tear and bulge. It wasn't like the bottom disc that was really badly damaged structurally. So they basically blew it off.
Yeah.
And they weren't going to do anything to help you.
And the first time I talked, the very first consultation you and I had was for my lower back. You asked me where it hurts, and I pointed it out, and you were like, yeah, that's probably your L2. And that was actually really gratifying because that was what I had been thinking, but nobody else, even some of the physical therapists, didn't seem to think it was relevant. So,
and I mentioned it during your surgery. You know, when we were in there with the laser, I mentioned that there are accidents that happen with people where they hyperflex at the L1-2, especially the old days when there were the seat belts that were lap belts without the shoulder belt.
Mm-hmm.
People would get into an accident and they would just be launched forward and the lap belt would hold them down. So they would pivot at L1-2 and they could tear the disc and injure the disc, and that would cause severe pain for the rest of their life. But that's what Deuk Spine does. We diagnose people's source of their pain quite well, and we can do all that through a free Zoom call, and that's what you did, and
that's
now you're here.
Really probably what sold me was you guys actually have a diagnostic. You can tell, this is why you have pain here, this and this. That's all I needed to hear. You know what you're doing.
What's life going to be like for you now that you've got your lower back fixed?
Honestly, I have no idea. It's going to be a fresh start. I haven't been able to work for several years. It's been probably 4 or 5 years. I think I'd like to start my own business again. Maybe some kind of game store / library / coffee shop. I don't know. We'll see where things go.
Anything else you want to tell your fans and viewers out there?
If you're having back pain or problems, I definitely recommend coming here, getting checked out, getting your consultation, and seeing what they can do. Because if they say they can do it, they can actually do it here.
Well, thank you, sir.
Thank you.
I appreciate you sharing your experience at Deuk Spine.
Anytime.